When it comes to spinal injuries, the stakes are incredibly high. In the wilderness, where help might be far away, recognizing the signs early can mean the difference between full recovery and permanent paralysis. To determine if a spinal injury may be present, you'll need to assess the victim methodically. Ask yourself, is the person alert and oriented? Do they know who they are, where they are, and what's happening? Have they been drinking or using drugs? Intoxication can mask or mimic symptoms and affect your ability to clear a spinal injury safely. Are they suffering from any other painful injuries? Pay close attention to whether the person has neck pain, tingling, numbness, or weakness in any part of the body. Check for neck tenderness. Gently press along the spine and watch for reactions. Also test for sensation in the hands and feet. Numbness, lack of feeling, or inability to move limbs may signal spinal cord involvement. In some cases, you may be able to clear a spinal injury in the field, meaning it's safe to move the patient without spinal stabilization. But you must be absolutely certain of the following conditions. First, the person must be completely alert, aware, oriented, and responding appropriately. They must not be intoxicated. Drugs or alcohol can obscure symptoms. They should have no distracting injuries, such as broken bones or severe bleeding that could shift their attention away from spinal pain. They should not report any neck pain at all. If they do, treat as a spinal injury. Next, test touch sensation. Can they feel normal pressure or light touch on their hands and feet? Then confirm they can move their fingers and toes without difficulty. If all of these checks are passed, spinal stabilization is likely unnecessary, but when in doubt, stabilize. When the victim is awake and responsive, you can gather critical information directly from them. Start by asking, do you feel any neck or back pain? Next, ask, what happened? Understanding the mechanism of injury helps you evaluate risk. For example, did they fall, dive, or get hit with enough force to cause spinal trauma? Ask if they can move and feel their arms and legs. You're checking for both motor control and sensation. Then perform a DOTS check. Look and feel for deformities, open wounds, tenderness and swelling along the spine. Finally, test extremity strength. Ask them to squeeze your fingers, push against your hands with their feet, or perform other gentle resistance tasks. Weakness or inability to move are serious red flags. But what if the person's unresponsive? Now, you need to rely on observation and inference. Start by trying to determine the mechanism of injury. Did they fall from a height? Were they struck or involved in a rollover? Anything involving high force should raise suspicion. Then look and feel along the spine. Check for deformities, open wounds or swelling. Use gentle pressure and keep the neck in a neutral position. Also, obtain information from bystanders. Did someone see what happened? Did the person complain of neck pain before becoming unresponsive? These accounts are often your best tool for assessment when the victim can't speak. If you suspect a spinal injury, here's how to care for the victim with minimal equipment in a wilderness setting. First, use your hands and knees to stabilize the head and neck in line with the spine. Keep everything in a straight line and prevent twisting. If you don't have a cervical collar, improvise. Use rolled-up clothing, towels, foam pads, anything you can secure snugly on both sides of the neck to limit movement. You may also need to improvise supports for the body, especially if the terrain is uneven. Most importantly, avoid moving the victim unless absolutely necessary for safety. Movement can worsen a spinal injury dramatically. Keep them calm, reassured, and as still as possible until evacuation or professional medical help arrives.